It's something that people don't talk about.
I have a lot of friends who never sought out help for various disorders because they were afraid of that negative stigma.
There's a lot of people out there suffering from mental illness that either don't know they have it or know they have it and can't get the help they need.
Doesn't matter where you are, there will be help. It is there.
I've suffered from anxiety off and on most of my life. I've been coming to see Dr. Segal for 2 years. She has a really calming presence, and more so than that, she really helps you to look at yourself.
Anxiety is just a normal physiological response that all of us have. But in some people, that anxiety response gets provoked even when there is either no danger or it is provoked to an extent that it becomes debilitating. It affects the mind by generating a very distinct set of symptoms, which include a palpitating heart, sweating, feeling lightheaded, feeling like you're going to pass out, feeling sick to the stomach, so a very strong physiological response.
My anxiety was that I would obsess over little things, but it would get to the point sometimes where I would overthink things and find myself staying up in the middle of the night thinking about how I could have written an email differently. She's really taught me to just something as simple as taking a couple deep breaths and recognizing the fact that it's just a job and it's not who I am as a person. She helped me really just appreciate the things that were more important. That way I could let go of the things that were weighing me down. That's the part that I think is really important for people to understand is it's not this big crazy journey. It's not like I have homework every night to try and learn how to unpack my brain. It's really just talking to somebody, her saying things that the average person wouldn't know to say to help you delve deeper into why you're reacting the way you're reacting.
I have schizoaffective disorder, which is a disorder that is schizophrenia combined with depression symptoms. I've known Dr. Segal now since 2005, and she's one of the major reasons why I came back to work was through her support, the support of my family and friends. Without that, it's a really tough thing to go through.
Schizophrenia is a chronic mental illness that is characterized by the patient experiencing delusions, hallucinations, and sometimes moods that can fluctuate as well. For schizophrenia, the medications is the mainstay because the antipsychotic medications are the mainstay of treatment. And with that, as with any other mental illness, the education, the awareness, the therapeutic techniques, because a lot of these patients, feel so demarginalized and segregated from mainstream society that they live in, that sense of isolation sort of pushes them towards considering suicide or, other means of ending their lives because they're just so misunderstood.
It's a very lonely disease, I would say, because you don't really want to talk about it, but a lot of people just keep it in and self-medicate. So I would just, want everybody, if you need help, don't be afraid to ask for it because it's there.
There is so much fear, there is so much apprehension, and all of it stems from not enough knowledge and information about the disease. And so educating ourselves even more importantly when we have a family member suffering from a major mental illness, and a commitment of the community to inform and support these people becomes critical. As we head towards the holiday season, it always surprises me that we tend to talk more about mental illness at that time because the holidays are a big trigger. If you look at all the different factors that can be stressful in the holidays, whether it's financial difficulties or the family dynamics that surface during that time, or your own self-care that goes down, the overscheduling that happens, any of these in and of themselves are significant enough in the course of a year to cause us to be depressed. To cope with it throughout the year, building yourself up strong as you work towards the holiday season, I think is really helpful. And I give a shout out to all the people who are struggling with mental illness, who are not giving up when they don't get the help they need in the timely fashion that they need it, and still persevering and trying to do what it takes to stay well.
Learn more about mental health at BayAreaHealthierTogether.com.